Our next speaker will be Valerie Donovan, who's the Suicide Prevention and Mental Health Promotion Coordinator with University Health Services at UW-Madison. She'll be discussing evidence-based efforts at UW-Madison to prevent suicide and to connect students to mental health services. So thanks, Valerie.
So good morning, everyone. Thank you so much for having us here today to talk about this really important topic. So I just want to point out right from the beginning that my contact information is available on the slides. 15 minutes is a pretty limited time frame to really cover the depth of this issue. So I just encourage folks that have questions or comments or would like to consult further about any of these topics to feel free to be in touch. I also want to mention too, before I get started, that college is typically considered in the field to be a protective factor for students. However, I want to say right from the beginning that we know that there are significant stressors that students are experiencing, and I'll talk a little bit more about what those look like and what that means for our efforts, but I will be focusing on college students specifically, and not on any one particular age range. So just what we know about college students overall. So just a little bit of a roadmap for where I hope to go in the next 15 minutes. I'm going to share some data that really highlights, I think, the scope of this issue. I'm not going to focus on a ton of national data, but rather share some of what we know from UW-Madison, from the studies that we've done, as well as a couple data points from UW system about these issues. I think then we'll kind of delve a little bit into what we know about evidence-based population level strategies. So my role on campus is really thinking about primary prevention and those more upstream strategies to create conditions that are supportive of student mental health. So I'm not a mental health provider on campus, but I do work closely with folks that are supporting students on that individual level. I'll talk a little bit about our approach at UW-Madison and then offer some consideration for policymakers, decision makers, and thought leaders in the room about how we might better address this issue in college campuses. So just to kind of lay some foundation, consistently suicide has been the second leading cause of death for college students nationwide. This is, I think, really aligned with sort of what we've already heard about the age range suicide rates. So I'm not going to share a ton about national data. However, we do have some information from UW-Madison and UW system about what kind of the state of our campus looks like. So I'm going to talk about two studies and two assessments that we've done at UW-Madison. The first is the National College Health Assessment, or NCHA. This comes from the American College Health Association. UW-Madison participates in this about every 3 years, and UW system has also participated in this study as well. So we have a little bit of data about system level campus experiences. So I'm going to share some data from 2015 and 2018 from that study, as well as a little bit of data from the Healthy Mind study, which is something that we conducted at UW-Madison for the first time in 2016. We will be doing that study again in 2019. Both of these studies have yielded some results that give us really, I think, a bigger picture of what mental health, what suicide looks like on college campuses. And there's certainly some limitations in terms of what we still don't know. The samples that we have from these studies are representative samples of the students, but it is not a kind of a snapshot of the entire student body. So the first thing that I want to talk about is suicidal ideation among college students, and particularly what we know about UW-Madison and UW system. So each of those surveys that I mentioned asks about students' experiences with suicidal ideation or suicidal thoughts in the last 12 months. In 2015, UW-Madison students, about 7.7% of UW-Madison students reported experiencing suicidal ideation in the last 12 months. And I have up here kind of the the other moments in time that we have information about this, and most recently in 2018, when we asked this on our National College Health Assessment on campus, about 14.5% of our students indicated that they've experienced suicidal ideation in the last 12 months. So extrapolating that to how many students are at UW-Madison, that's just over 6,000 students on our campus. System data is pretty comparable there, 12.6% of students, and I know a little bit less about the methodology of the system survey and how that went out. But if you think about that in terms of statewide impact among college students here in Wisconsin, that's just over 21,000 students, which doesn't include private, technical, or community colleges. So I think for me, what this really demonstrates is that this issue is trending in a direction that that is a little bit, I think, scary for us that are doing this work. Right? We're seeing significant increases in ideation. And I think when we look then at suicide attempts and the data that we have there as well, it kind of matches that same trend that we've seen for suicide ideation. So as in the 2018 study that we did, 1.8% of UW-Madison students reported that they had a suicide attempt in the last 12 months. This is all self-reported data, but I think shows kind of the scope of this issue. Additionally, we know a little bit about the kind of other side of this issue, right? And that is how many survivors of suicide there are on our campus. For those who don't know, a survivor of suicide is someone who has lost a loved one to suicide. And we asked this question starting in 2016 on our survey and learned that 1 in 5 of our students on campus identifies as a survivor of suicide, that they've lost a loved one. And in 2018, that number increased a little bit as well. We don't have data from earlier about this question, but we'll continue to ask that in future studies. We also know a little bit about sort of what informal help seeking looks like at UW-Madison, and I think for me this really speaks to some opportunities that we have to intervene and to build systems that are supportive for students. So when we asked about witnessing or interacting with someone experiencing significant emotional distress or thoughts of suicide, 42.1% of our students said that they have been in that situation in the last year. And I think what's not on here, but what is noteworthy is of those students who said, yes, I've been in that situation, 91% said that, yes, they wanted to do something, that they tried to intervene in some way. So that to me speaks to really an opportunity to look at some of those evidence-based gatekeeper trainings that other panelists have shared about and think about how we can really implement them in a robust way on campus. We also know that students who are experiencing emotional distress are most likely to go talk first to a friend, to a family member, a significant other, or a roommate. So pretty low on that list is clinical professionals. So we know that the role of peer support is huge. And lastly, I think in terms of data, it's helpful to know that there are some norms that are shifting in a positive direction that we're seeing. And these might seem small, but I think they're still important to note that students who are reporting a diagnosis of depression or anxiety are receiving treatment more often than they have in the past. And that more students are considering mental health support as an option for them and as something that could be effective. So in the last couple of moments that I have, I just want to take a step back and talk a little bit about the role that that prevention can play in this work. So my definition of prevention that I want to share with all of you is prevention is really this active process of creating conditions and attributes that promote the well-being of people. I think that process piece is really important. Prevention is not a one moment in time program or strategy or intervention. It really is involving kind of people and infrastructures. So I am focused in my work primarily in this primary prevention box when you look at the spectrum of prevention and thinking about how we can reduce risk factors and promote protective factors on campus. That said, I partner quite a bit with folks that are working more in the early intervention and treatment because it's important for all of us to be doing this work collaboratively. I'm not going to really get into this too much, but I want to share a little bit about the socio-ecological model because this is really widely adopted and known to be an evidence-based method of supporting a comprehensive strategy to suicide prevention. So this essentially indicates that we need to be focusing on all areas of this model in order to really move the needle on these health issues. So a little bit about the approach at UW-Madison. There is a handout in your folder. It's kind of a green one-pager that talks about the approach that we've chosen to take. We partner with a lot of different stakeholders on our campus through a suicide prevention council. This is a group that has been meeting regularly for almost the last 6 years on campus, and it's a great way to ensure that everyone on campus is connected to the strategy and can play a role in the approach. It also recognizes that there are multiple units on campus that have the expertise and the influence to do this work. The next slide is just a list of who is represented at the council. Membership has kind of grown over the last few years since we've been meeting. And the approach that we've kind of adopted as a group on campus in terms of thinking about primary prevention is what's called the Campus Program Framework. This is an evidence-based approach that comes from the JED Foundation, which is a national resource for suicide prevention on college campuses specifically. There are few campus-specific resources in this area, and the JED Campus Program Framework is something that we've found to be really helpful to us in providing structure to the strategy. This includes a lot of the things that have already been shared about best practices from the CDC around gatekeeper training, social norms clarification campaigns to reduce stigma, increasing screening for suicide and depression, as well as supporting student organizations and student leaders that want to be involved in this work. So UW-Madison has been participating in this campus program for coming up on about 4 years now. And essentially what this means is we've adopted this framework and have looked at 120 benchmarks, 120 indicators for a college campus that we should be looking at in terms of having a comprehensive approach to suicide prevention. So there's some more information in the handout about that, and I'm not going to get too into kind of the nitty-gritty of those specific recommendations, but I think some of the strengths and the opportunities related to this hopefully come out in my considerations for policymakers and decision makers in the room. So the first thing that I want folks to keep in mind and consider is the need to really staff prevention level work. So this is a challenge that I face quite often in my role. I have very few counterparts in the state at other universities and colleges across Wisconsin. So in order for us to adopt something like the JED plan, you need people to do that work and to help advance that strategy and bring folks together and really, I think, do what is behind the scenes in terms of prevention strategy. So that's something that has been a significant challenge for some of my colleagues across the state that are trying to address this in campuses. Kind of similarly to that, I think we're really lacking in terms of a statewide infrastructure that connects university and colleges across Wisconsin so that we can build some synergy, so that we can have some common language for what we're talking about with regards to suicide prevention on campuses. It would also be an opportunity to have consistent data and metrics for campuses across the state, as well as to share best practices and lessons learned. I think additionally, looking at policies and bills that are in support of population level prevention is really crucial. There are several examples from other states, and I have on my last slide in the slide deck is a list of some of those examples that I've found. But I think in terms of mandating something like an evidence-based training program for employees and students, when you think about the potential reach for that in our state, that's 170,000 students in the UW system alone, so not even counting private and technical schools. That's 39,000 employees in the University of Wisconsin system. So it's great that we have access to all of these evidence-based programs, that we're able to check the box that we offer them to students, but unless we're really saturating this message and infusing this in the values of our institution, we're constantly going to be kind of struggling to get people on board. I think additionally, as has kind of been highlighted by some of the other panelists, there's still a gap in terms of research around suicide prevention. The field is really kind of in its infancy when it comes to research. And I think in particular in terms of understanding and addressing health inequities across the state. That's something that we just do not know very much about in terms of what works for prevention, and any funding or research that can support helping us understand that better would be really helpful. I think we also know quite a bit about the connection between mental health and academic success, both in higher ed and in K-12. And so I see an opportunity as well to really tie that to mission statements, vision statements, value statements, and strategic plans, both in institutions of higher education as well as other areas of the state. And lastly, I just want to share a little bit about a recent survey that came out. This was a Harris poll that was supported by the American Foundation for Suicide Prevention as well as the National Action Alliance for Suicide Prevention. And really what it suggests is we are at a pivotal moment where there is a shift in public perception about suicide prevention right now. They learned that 94% of the Americans they surveyed believe suicide can be prevented and would want to take action to help someone. However, only about a third felt like they could identify somebody who is at risk. So I would just, I guess, end by encouraging folks to just consider where we are in terms of the national conversation about this right now. I see a lot of support for this work in my role on campus, and am encouraged by this opportunity to share a little bit about that with you all.